So good afternoon, everyone. My name is Laleh and I'm the Senior Health Human Resource Analyst for the BC Care Providers Association. And I'd like to welcome you to today's webinar, which is focused on recruitment solutions with TalentBox Workforce Development. I'm going to introduce our speakers in just a moment, but I'd like to handle a few housekeeping items up front. Before we get started, I would like to acknowledge that we're hosting today's webinar on the traditional and unceded territory of the Coast Salish peoples, including the Squamish, the Musqueam, and Tsleil-Waututh, and I'd like to extend my appreciation for the opportunity to hold this dialogue here today. I do know that many of you are joining us from across the province, so I do invite you to acknowledge your own territory in the chat function. Speaking of the chat function, we're going to be saving some time today for questions at the end. Do please feel free to use the actual Q&A function for your questions, and then I can direct those questions to our speakers. But on that note, I am pleased to turn the presentation over to our distinguished guest. First, we have Rob Mingay. Rob is a founding partner at TalentBox Solutions. We actually first encountered Rob here at BC Care Providers in his former role as the Assistant Deputy Minister for the Ministry of Jobs, Trade and Technology. Thank you very much for joining us, Rob. Second, we have Laleh Sabha. Laleh is a regulated Canadian immigration consultant with TalentBox. Welcome, Laleh. Third, we have Kathy Gibson, who is an associate with TalentBox. We also have Patrick McKenzie. Patrick is the Executive Director of the Immigrant Employment Council of BC. Nice to see you again, Patrick. And then lastly, we also have Gavin McIntosh. Gavin is the Vice President of Finance and Operations at the CARE Group. And Gavin's actually kindly agreed to participate in today's webinar, sort of an audience surrogate, a potential customer. And he's going to be asking some hard questions before we turn it over to the panel, to the Q&A section. So without further ado, I'm actually going to turn the presentation over to Rob and Laleh. Go ahead, folks.
Thanks so much, Laura. If we could go to the next slide. It's great to be here this actually sunny afternoon in downtown Vancouver. We're telling you a couple of things you already know, but let's just quickly go over them. There were, in pre-COVID, the BC government estimated 17,900 job openings for care aides over the next 10 years. So there is a significant challenge for residential care, home care, and residential care. Healthcare overall. The pandemic has compounded that, but the opportunity that's come out of this crisis is government. This has clearly come to the attention of government now after both the BC Care Providers and other agencies talking to government about this looming problem, and governments are now starting to throw some resources at it. So what we're here to accomplish is fill vacant positions with skilled international talent. So we handle both the recruitment side and the credential side and the immigration side. And in doing so, we hope to improve the level of healthcare meeting or exceeding the Canadian standards. Next slide, please. So we're going to take you through a process flow here. And I'll just quickly, the employer engages with us. There's a marketing abroad and engaging talent. So we work in the Middle East, we work in other parts of the globe, looking for talent. There's an assessment and verification process. That's what Patrick will take you through. There's an assessment of educational qualifications. And at that point, after all those 4 steps have been met, we then would bring qualified candidates to employers after we've done pre-interviews and qualified them and make sure that they have the right credentials. So if they don't, we know what gap they have to close. And then into hiring and then the post-hiring supports. So we're going to take you through all of that. We'll go to the next one. So this is the first, which is the employer engaging with TalentBox. So I'm going to throw this to Kathy Gibson, and she's going to take us through a couple of slides. Thank you, Kathy.
Thanks so much for joining us here today. My pronouns are she, her, and I am also joining from Polish Tsleil-Waututh Solutions here at downtown Vancouver today. So the initial engagement with TalentBox would look like an employer would identify vacancies and then submit a requisition in which we would engage in a full cycle of recruitment support for employers. So my background is like a global director of HR, so I understand the pain of finding and acquiring talent and what goes into the verification process, as well as ensuring that we're going to find talent that is going to be retained and grow with an organization and be in it for the long haul. So once we identify the key needs that you're after, essentially we're going to be sourcing for the most critical roles to start, really focused around NOC 3413 and 3414, identifying care aides, licensed practical nurses, recreational assistants, registered nurses, etc. Essentially, once we have established what the most critical path roles are that we're looking to fill, we have the opportunity to then pivot and expand the roles into the future, dependent on ensuring that the Canadian standards for hire are being met and assisting the candidates in being prepared for their interview process. So essentially what we're looking to do is TalentBox will funnel qualified employment-ready talent that meets Canadian standards. We're shepherding the international talent through the entire process. That includes assessments and verifications, referrals to educational programs, immigration application processing, relocation and settlement support referrals, and then supporting in the recommendation and development of innovative immigration pathways and solutions around this as well. I have worked very closely with Rob in the past around immigration policy pieces, piloting solutions for the technology sector, for example, and looking at the BCPMP as pilot mechanisms and various consultations with the federal government around global talent stream and other mechanisms. And there's significant interest in trying to find pathways for the skilled talent that we require here in Canada.
So this is over to Laleh on the marketing abroad and engaging talent.
Yeah, thank you, Rob. Regarding the marketing to the candidates, TalentBox, what the goal of TalentBox is, goes to the overseas and mainly to the Middle East area and the North African market, and with the international contact which we have overseas, try to establish the relationship between foreign workers and the employer, Canadian employer here. So next one, and then to
we're going to move on to Rob first.
Yeah.
Slide 8. Yeah. So in terms of assessments and verifications, so just in terms of the assessments and verifications, essentially we'll run through all of the different scenarios that need to happen in terms of all of these verifications of the talent that's coming in. So that would include, and they're all assessed in advance of employers even having contact with the candidates. So essentially, from a language perspective, we're looking at the IELTS, so the International English Language Test, the CLB, the Canadian Language Bank benchmarking, and the Canadian English Language Proficiency Index. Then we move on to doing educational verifications. We partner with World Education Services through WES to verify educational credentials. And finally, we also will take care of doing all the background and sustainability checks so that the candidate will be basically interview ready only after the verification and assessment process. So that would also include all of the medical testing, criminal record checks, psychometric testing that needs to happen. And of course, that's confirming the suitability of the candidate for the job so that the candidates that are in front of you as an employer are meeting all of your criteria and are ready to work. So the verification and recognition of skills and credentials is part of this process so that we're acknowledging the abilities of the individual and respecting the human dignity around that. So we're really doing a deeper dive into what the talent has to offer and what qualifications they may have already had the opportunity to acquire and to have displayed in previous employment, for example. From a work experience perspective, we're also verifying all of their work experience. It's all verified through TalentBox, ensuring that the talent is adequately prepared, and then we're essentially funneling this talent into the Immigrant Employment Council of British Columbia. I'm really happy to pass the floor over to Patrick here, who is the CEO of the IECBC, the Immigrant Employment Council of British Columbia, and so he can introduce us to FAST, the Facilitated Access to Skilled Talent component here as well.
So just before we do that, we hand it over to Patrick. It's really important to see this as all as a series of connections, a series of links that come together in terms of delivering the right kinds of potential employees, that they've been vetted, that they've gone through a process, that the vetting on their credentials here is done domestically. So over to you, Patrick.
Well, thanks, Rob. And that's it. I guess while TalentBox and IECBC are two different organizations, we work hand in glove to make sure that the process works in a way that gets exactly the talent that you would need. That's a focus of the Immigrant Employment Council of BC, just right across all of our programs. While we work in the immigrant settlement space, we are not actually focused on the immigrant. We're focused on the employer. So we want to make sure that the labor market is ready to, one, recognize that immigrant talent is there, but then be able to find it, recruit it, and retain it. All critical steps in the whole process. So for us, again, we work very closely with employers. Our programs are developed with employers' input, with their participation. We don't do anything in isolation. Certainly the BC Care Providers Association does not want to hear what I think is required of a worker in one of their facilities. I need to hear that from you so that we can find the right person and make sure that we're assessing people in the right way to get to that talent that you need and mitigate any of the sort of unnecessary risk in a hire. And we also provide toolkits and other programs to help employers throughout the whole process. But specifically, I want to talk about our FAST programs. This stands for Facilitating Access to Skilled Talent. It's an occupation-based assessment. We work with industries to make sure that we're able to screen someone from overseas against criteria that you as an employer would expect from a Canadian educated or sort of Canadian experienced worker. So we focus on the competencies, so the skills, go back to Kathy's point about really recognizing what that individual brings to the table now. This isn't a shortcut to employment, rather it's a pathway and a guiding light to getting that employment that makes the best use of an individual's skills. That's great for the individual, it's great for the immigrant, it's ideal for the employer. In doing the assessments, and again, we do them hand in glove with industry experts. So we are already in the skilled trades, we're in IT and data services, biotech and life sciences, accounting, and tourism and hospitality. And in developing these assessments, what we also do is develop training plans that work alongside them. So as someone goes through the assessment and reveals gaps in their knowledge, gap training is compiled in the background so that that person can address specifically what they're missing. I can use the example of the carpentry stream that we have. As someone gets a question wrong, the system pulls the exact chapter and paragraph out of the textbooks that a Canadian would use and compiles them in this personalized ebook so that the person can then study and retest again. FAST is all online. And involves, there's video, there's also not just a technical assessment, but there's also a preparatory piece called Prepare for Work in Canada that helps situate the person in the context of the occupation here, particularly important in a sector like long-term care. So in using this, FAST approach, and we've seen it certainly in our existing streams in biotech, skilled trades, and in IT, accounting as well, that this screening and the accompanying gap training helps prepare candidates for exactly what an employer is looking for. So we can meet or exceed your expectations, and we expect to do so in long-term care as well. Like I said, candidates get personalized training that addresses their specific gaps. We also provide support for professional development so that we can help people, even people who are already in the system. You could potentially run your existing employees through to help with professional development there. The demand for the workers in this field is, it's almost insatiable at this point. We will use this screening to meet that demand. Not only can we do it overseas, but also we're in partnership with tourism and hospitality industry and some of the sectoral actors right across the country. We're looking at those occupations that are in Canada that have similar competency profiles to some of the non-regulated occupations that you would have and the needs that you would have, to see if we can't transition them over in a more timely fashion. We have a network of service delivery partners right across the country. I think at this point, these numbers aren't exactly reflective of where we are today, but we have 64 partners right across Canada, plus another 100 or so who are looking to come on board so that they can deliver the FAST program to newcomers. So what this does is it opens up the door not only to the overseas talent, but the people who are already in Canada who may live in another part of the country who could then come to work for you. We'll go to the next slide. So I said that when we develop our streams, we do it with industry. Because again, you don't need me telling you what you need. So this is why Lara and her colleagues have been so tremendously important in the BC Care Providers. We're taking your guidance in terms of what the critical occupations are, where your needs are, both regulated and unregulated, so that we can meet those needs. The assessments will be developed with your subject matter experts, as will the gap training. You can see that we NCAS is a part of this process, and they're helping us identify, they're helping us use their assessments to identify those workers that they regulate. And I know there's great demand for healthcare aides, obviously, and nurses that they can help with. You can see, if we can just go back for 1 second. So Stenberg and Norquest colleges, again, on the gap training, and these are the post-secondaries that help create those workers in Canada that you need, and goes without saying, TalentBox.
If I could just add to that, the educational institution partners. So we're in the midst of building out that architecture on the educational partners. So domestic obviously is very important, but also international educational institutions. So be it South America, in the Middle East, et cetera, where we can, where a curriculum, Canadian curriculum, BC curriculum can be taught and delivered under license in those post-secondary institutions.
And then to do all this, of course, we have a governance committee that's keeping a close eye and providing that guidance that we need to develop at the stream. So this program has been funded through what's called the Future Skills Center. They're based out of Toronto. And so we're using their funding along with the partnerships that we have with Rob, Laleh, Lara, and a number of others, including the ministry we're looking to pull in, and the nursing regulator too, to make sure that as we build this process out, the assessments actually assess what you need, so that you'll get the talent that you need, but that we can also address any of those other issues that are out there. Certainly regulated occupations, there's no shortage of issues with bringing international talent over, but then the immigration pathways as well, looking to make sure that we might be looking for opportunities to piggyback on existing programs to fast track those workers that you need so critically. Rob?
So the talent acquisition solution process flow continuing. So qualified, we're at the stage now, we've talked about education, now we're at the stage where qualified candidates are sent to an employer. So it's based on assessment and verifications. Then, and then only then, do we refer candidates. Then we move to the next stage, which is interviews. So we do the early interview to, so you're not wasting your time. We do a bit of a short list. So we take the talent pool. If they qualify under the correct NOC, 3413, 3414, 3414, excuse me. Have they completed the programs? If they haven't, what's the gap? We prepare them for the interviews. And if they're not ready, we refer them to the relevant programs. On non-regulated candidates or those who already meet the Canadian standards, we prepare them for the interview and then submit them to you for an actual job interview once they've been prepared. Next slide. So the hiring. So we're at stage 7. So we can go to the next one. So candidates will be selected for interviews. They'll get support and preparation from us, be it resume writing, mock interviewing, some career coaching. And then we'll leverage the applied curriculum to empower newcomer development, Ascend, other AI interview technology, which is starting to emerge day by day. And then we'll work in collaboration with IECBC. So we can go to the next one. So the post-hire supports. So we'll assist employers with work permits, LMIA, labor market impact assessments, the candidate's application to provincial nominee or federal streams. And I'll maybe just take a moment and talk about the provincial nominee program. So some time ago, when I was the Assistant Deputy Minister responsible for immigration, we created something called the Tech Pilot. Actually, Kathy had a hand in that, in our forming that. And it was a temporary pilot because we had a real hiring crunch in technology. So we set up something for expedited processing for the provincial nominee program. It worked. It's now been made permanent. What we're proposing to do is now go maybe in some kind of a coalition. It could be IECBC, ourselves, the BC care providers, other employers, and say to the provincial nominee program and the immigration policy people in the provincial government, look, it's time to add a couple of more knocks to the pilot of what was called the Tech Pilot. It doesn't matter what you call it, just add these knocks to it, do it on a temporary basis, see how it works. But it gives priority processing. It can happen in as little as 14 days to potential PNP nominees. And then we work in facilitating the process for the candidate and their family. Either it's referral to immigrant services societies or supports in the community. Next slide. Aftercare. So, you know, some of this, one of the real challenges, I know Gavin's talked about this, is stickiness on employees, on new people, particularly when they're coming from somewhere else, be it the Middle East and so forth. They're thrown into a new culture. So it's important that we continue to work with the candidates, that they're connected to other service providers, they're getting the kind of support they need, and that the stickiness is there, that they end up staying with you as an employer for after you've made the investment for a period of time. So, next slide. So the continuous flow of talent to meet labor market needs. So what we're doing is we're building the pipeline now. And what we need to do is work with you as employers to start filling that pipeline. And once we get that pipeline starting to fill, there'll be some real savings on recruitment and higher rates of retention. It'll start to gain a reputation. It'll start to be seen as a potential path. One of the reasons we're really focused on initially, and I say this very much so initially, with the Middle East, is because there's so many expats living in Dubai and UAE and other places like that who can't get permanent residency. There's no pathway in those countries to permanent residency. Canada, as it's seen as a haven for investment, you know, stable government, safe, you know, growing economy. It's also seen in the same way for potential employees and candidates. So it's a very attractive, and even people taking a pay cut, it's still seen as a very attractive place to come. So, you know, we will have access to talent committed to full-time employment and can meet, and we can and will meet the Canadian standards and requirements. Go to the next one. So next step, we need to refine the competencies framework. We need to do some testing for validity and reliability. And it's our intention to roll out no later than October 2021. One of the things we'll be doing is regular overseas marketing. And as international travel comes back, we'll be in a position to do that as we go forward. So we think by September, October, we'll be in a position. And when we hold these seminars overseas, we don't get 5 or 6 people. We get 600-700 people coming out to these over a period of days. So we're able to get really deep into the employee pool. Next. So next, we want to engage with individual employers. We want to do outreach and engagement directly to the members of the BC Care providers. We've joined now, so we're a commercial member. And we want some recommendations to enhance pathways through our network to meet critical labor market needs. We've got the ear of the federal government. We've got the ear of the provincial government. It's a unique time in our history. You know, never waste a good crisis. And the crisis has been created by COVID, and the crisis has been created in residential care is also one of the better opportunities that's come along in at least a decade. I think that's our last slide.
Yes.
It is. So I said we'd do that in half an hour, and we have. So that's great, and I think we can take some questions. Laura, how would you like to handle that? I see a question. Should I just go to that question? Yes, okay. So the question is, I'm sorry, I got to get close to the screen, is the LMIA process is very onerous. Is it necessary to go through this if we want to go through the provincial nominee program? Is it possible to get a blanket LMIA for our sector? It's a really interesting question, because I've had those kinds of discussions with Immigrant and Refugees Citizenship Canada. I think the short answer, without being definitive, and I think you probably agree, Patrick. Patrick is a former, also we're recovering bureaucrats, the two of us. He worked in the immigration department. But I think there might be some openness to some kind of process for expediting labor market impact assessments. We understand it's onerous, but we clearly have an opportunity. As I say, don't waste a crisis. On the provincial nominee program, I think we answered that to a certain degree, that we could potentially have an opportunity there. We're certainly going to pursue it, and we're going to do it soon. Just curious, how much of the time?
Might I just add? I would just say that so I had the opportunity to present at the parliamentary hearings on the temporary foreign worker some time ago, and we were in a position at that point in time to sort of really make some concrete data. Typically, if we can gather the labor market data, which is very compelling right now, and we have the ears of the provincial and federal governments, you know, we were in a situation, for example, with whether it be Global Talent Stream or the BC Provincial Nominee pilot program. These pilots or blanket LMIAs are definitely plausible and possible. And when we have compelling labor market data, it becomes an easy sell for government to create solutions around this. And so they need to be socialized within government. But certainly it seems like it's a prime opportunity to be having these conversations certainly right now.
I agree.
There's also, I mean, with the LMIAs, there is the dual purpose LMIA, which costs effectively exactly the same thing or close to it. And that it's faster processing on a dual purpose LMIA, and it offers that pathway of permanent residency as well. So there's that one to keep in mind. There are also francophone immigration programs, and don't get me wrong, I know that we're not looking for unilingual francophones in long-term care here, but that's not exactly what the program facilitates. And so through some of these other channels, francophone being one of them, someone who has any facility in French can potentially be fast-tracked through that process as well. So there are options. And again, we are talking to both federal and provincial governments to see how we might not create even more efficient pathways for your needs.
Sorry, Gavin, go ahead.
Well, yeah, I was just gonna, thanks very much. Very, very helpful. Nice to sort of see it presented in those bite-sized steps. And I think, speaking from my experience, in our company, at one site we have 20 LMIAs right now, because the either filled or in some cases just unnamed LMIAs. And we do have this big issue, and in line with Al's question, which is, can we get a blanket? And in our experience, what we were able to do is to say, listen, we've got 10 empty HCA lines. So we need five LMAs. We haven't found the people yet, but we've got this big gap. So can we please just have access to this on the temp foreign worker side? And it's been very helpful, because then we doing our own recruiting are able to find these people that we then slot in. And again, back to sort of Al's question, and I'm not sure what that other LMIA process, that dual, I don't know the details on that, but do we see that, I wonder whether we, as a company or as a region, whether there are, the island and the interior being particularly challenging, in line again with Al's comment, do we see any way of speeding up that by just having bigger blocks, and that we all get our piece? Because as operators, I've spent at this one site north of $50,000 just getting through the LMIA process, and there hasn't historically been funding for that, and funding is what makes our world go round. And I assume that you guys don't work for free. So is there lobbying to be done with the government to help support this need? Like when the government went to 3.36 direct care hours, there wasn't additional funding for the recruitment. It was dollar for dollar for those hours worked. So how are we, do you see any ways for us to pay for this?
Yeah, so first of all, we're here to help with the LMIA, and we understand. And I want to come back to Al's question about rural areas, so don't let me forget that. We think that there is, as I say, don't let the crisis go to waste. We think there is an opportunity to take some of the allocated monies that government is saying they're going to put up. So I find it interesting. The provincial government has said they're going to put, I can't remember the amount, if anyone can remember, remind me of the amount of money they said they were going to put in to residential care, recognizing the crisis. But they haven't determined how that's going to get spent yet, how that's going to get allocated. So I think there's an opportunity, and yes, there's a need to do some lobbying on that. And just as I mentioned, the PNP, I think this needs to be packaged together in some kind of way. I don't think it's that difficult. Patrick and I and Kathy know very well how government functions that way. So I think the short answer is yes to a big problem. I'm just going to go to Al's question.
There's just one piece I can add to, sort of on the lobbying front. With the express entry system that the federal government has, to pull permanent residents in, those are operated through ministerial instructions, those polls. And a ministerial instruction is basically policymakers in the government telling the minister what makes sense to emphasize and to look for in that poll. And when I say that poll, it's, you've got a pond full of fish, but you only want fish of a certain size, or that meet a certain points threshold. And so you're invited to apply and you hit this threshold. That threshold has dropped significantly. It's actually hit the lowest it's ever seen, both for the PNP recently and just overall a couple months back. And so I used to be one of these policy advisors. And so it's a matter of speaking to these fellows and articulating the need that's here. And we can potentially also then facilitate movement through the express entry system. So for permanent residency, and that doesn't require regulatory change.
Yeah, I would just very briefly add, just on your point, Gavin. I'm relieved and happy to hear that some employers are taking advantage of sort of the unnamed LMIA approach, where it's like, I've seen firsthand with the visual effects, animation, video game sector. It's like, I know I need 30 programmers. I'm going to now have unnamed approved LMIs for these roles, and we're just going to be applying them, to as we see fit through the criteria. And it's been very functional, and it's definitely worked for a lot of folks. And I think that there's a few different levers here that can be pulled, whether it be around express entry criteria, the BC Provincial Nominee Program, the LMIA process, and creating whether it be a specific blanket based on the NOC code itself or the sector and the various roles that need to be addressed in terms of the labor market needs. But it seems to me that there's a number of levers here that can theoretically be pulled. And then just as it pertains to rural BC, I think this is where there's almost a tremendous advantage in using TalentBox, because Laleh and her team have offices across the globe. And yes, people will be like, oh, Vancouver sounds like a great place to be. But also there's there's a cost of living, component around and a safety component. There's various reasons why people move to Canada, and having the opportunity to move to rural BC can be marketed appropriately out into, internationally, and so that we are sort of targeting certain areas to ensure that those gaps are filled and the labor market is that those potential candidates are having the opportunities in various areas across the province.
And I guess just I'd add to that, it was mentioned earlier in the presentation around psychometric assessments, because especially in long-term care, just because someone has the technical skills to do it doesn't mean we want them doing those jobs. And in particular, when we talk about people, say, transitioning from a job with a similar skills profile in, say, tourism and hospitality, for instance, and moving over. But as part of the assessments, one of the pieces that we're interested in is, where might people fit best? Or is this someone who would find a rural setting much more appealing than an urban setting? And the real advantage with going overseas to find the talent is you get them into a job that pays them well, gives them security. They're less likely to leave. That attachment starts right away, and so we think the combination of it all will provide a strong solution to that issue of actually getting the talent there.
We'll go to Karen's question. With the growing need for dementia care in our long-term care system, in your assessment verification process, do you take into consideration skills dementia, such as proof of dementia care education? Sorry, my glasses aren't working. Frontline experience of your candidates. Thanks, Karen. That's a very good question. Really, that comes down to what your criteria are when we interact with you. So when you look at that last slide, 32, engage with individual employers. If the criteria is indeed to be looking for people who have dementia care training, absolutely, that becomes part of the criteria. So yes. How much time does it take to finally have the person on board? We can't answer that definitively right now, but we're thinking, Laleh, do you want to weigh in on this one? I was about to throw something out, but
there are some components to that one, because we are working with the province here, and we want to see if we can create that pathway. With that pathway, for sure, the immigration process will be much faster than the current situation. But if we want to say a healthy timeline, I would say 3 months.
I'm more optimistic, I'll be honest, and I've only because I've seen it with the tech sector and the immense needs that were identified based on labor market data, and we can bring people in 3 to 4 weeks. So it is possible. obviously there's a lot of work to get done, and that's not to say out of the gate we'll be there, but I think that there's the opportunity here to be really optimistic in terms of where this could go and what this could look like, particularly once we have candidates that are out of the educational, like if we get the partnerships and the curriculum sorted out and people are coming out, it could be quite a quick process once we establish that stream of qualified talent.
So Patrick was just whispering in my ear. Kathy from BC Care apparently wanted to weigh in on this, or have I misinterpreted that?
No, I think that's what I saw flash up on the screen.
Oh, okay. The Care Aid Registry is another hurdle that needs to be overcome. Can you assist with this? We need to work with them. There's no doubt about it. And when there's a broader coalition and there's broader will, both from the provincial government and the federal government's and employers and recruiters, we're much more likely to get their attention. I spent a lot of time working with credentialing organizations when I was in government. Some of them are great, and some of them are there to protect by putting up barriers. So we've got to help kind of break those barriers down. But I think we've got a better chance with a much broader coalition to do that. Gavin, you wanted to say something?
Yeah, and I was just wondering, one of the things we noticed right around, I guess when the jobs numbers came out a little while back, and we were trying to get folks that were maybe housekeepers or, not credentialed in a sense, they may be credentialed in something else, but coming in, is that things became a little bit tighter because there were Canadians that were out of work, and they might have been, whether it was kitchen work or housekeeping work or laundry work, that those ones were a little bit harder to get through, or that there were some more roadblocks there. I was just wondering, and for us, I think the main need for us is, it might be the RN that gets credentialed as the HCA initially, and then makes their way up. But I think, I wonder what your experience has been with non-care focused, and whether there's been a care industry sort of bracket that can be put in to say, here's a major need area, because a housekeeper in the care space versus a housekeeper in the hotel space might be viewed differently. I'm not sure, but that's sort of something to think about, and whether we want to lobby that way. But also sorry, go ahead.
Oh, sorry, I meant to cut you off there, and I can answer that when you're ready.
Yeah, and then just for us, I think the most important thing is that we're really short on RNs, terribly short on RNs, because there's just been such a need. And who knows, maybe there'll be a little bit of a rebound as we come out of all the vaccinations, et cetera, and maybe there'll be a little bit more. But then also just on the HCA side, and the schools, and the cost of the schooling is so high. So is there, and I saw there was the notes about Stenberg, and I think Stenberg maybe had been looking at doing some educating overseas, but how close are we on that? Or I just realistically, is TalentBox and is everybody feeling like we're getting close to having a fast track?
So from IECBC, we're actually, we're partnering with NCAS right now to take a look at how we bring their assessments sort of into this process in a way that does truly facilitate people finding jobs, and finding the right jobs. And like I said, it may be someone who is the equivalent of an RN in their own country, might start off as a healthcare aide here, but we want them to have that pathway to upgrade if they can. Now, the challenge, obviously the challenge with regulated occupations is that there's a regulator, and it takes a little longer generally to get them on side. So what we began this process, with the intention of focusing on RNs, LPNs, and healthcare aides. And then as we had the conversations, both with NCAS and now with the, pulling the regulator in, we realized obviously we need more conversation. More has to happen, and there has to be a greater level of, say, comfort from their end and understanding of what we're doing and where we're going. So that is sort of our second tranche, as it were. And we're starting to focus, and Laura's helped us figure this out by canvassing, many of your members, we're starting to focus on some of those other jobs like recreational aides, looking in the kitchens and whatnot. And with that, we're setting up, we've brought in another partner, from Ontario. And I think there's been some back and forth with Laleh over the last couple of days around some subject matter experts who can help us figure out that transition from, from another sector into exactly what you'd need in your sector. So assuming that the competency profile won't be exactly the same for folks who would be working in a kitchen, say in a restaurant, as it would be in one of your facilities, but then how do we transition them over? Because we do know that the labor market has changed, but we also know that we're also expecting there's going to be quite a bit of demand sort of moving forward, and in particular in your industry. So we're looking at both ends, so that regulated, unregulated, and we want to be able to solve your needs as fast as we can, as quickly as we can. And with some of that, we're expecting that it will involve a transition from a declining sector like tourism and hospitality into your facilities.
So on one question here from Eden Gardens is, will this, you've got a critical shortage of LPNs and registered nurses. So if you go back to slide 5, which is up right now, licensed practical nurses are on that list initially. We fully plan on expanding to registered nurses, but we want to make sure we've got everything functioning, and that their credentials will be recognized. And as you know, registered nurses, it's almost a global market now. I think about other industries I've worked in, like underwater welders. There's only so many out there. They travel around the world. If you're an RN, you can go anywhere. So we fully anticipate we will get there, but we're not there yet. But we plan to.
Also,
So,
I would like to add something else about the Stenberg, and you mentioned about the cost of the education. The model that we were talking with the Stenberg College is to have the candidate, the farm worker, to study the course overseas. This will save the cost of the education for the farm worker and also cost of the living. And meantime, they can even continue to work in their home country and take those courses online with support of the educational hub in overseas. And then when eventually when we have the immigration pathway through the provincial program, hopefully, which we think is the greatest solution, because the tech sector has that solution now. And as Kathy mentioned, is that within 3 to 4 weeks, they can have the candidate here start working. This will help not only you as an employer, also the farm worker to save some of that educational costs.
Thanks, Laleh. So Algina from Park Place has another question. Is today, what is your success rate in placing care aides in British Columbia care homes? There isn't a success rate. So what we've done here is identify a problem. And as experts in the field of immigration and recruitment, we've identified a problem. And what we spent the last year doing is developing a solution. So, and we've done this very methodically. We've been talking with the BC care providers for many months now, many meetings. I've worked in my previous incarnation with Terry Lake, the president, and he's been quite encouraging on this. So this is new. This is a new pipeline we're building, but we once built, we have quite a degree of confidence that we're going to be able to see some real success. But we're going to have to get some real cooperation from different levels of both federal and provincial governments. But we're pretty confident there. So on the one hand, we're not rookies. On the other hand, we're building new infrastructure to go out and fill this need.
How much does it cost?
We charge kind of a standardized recruitment fee, which is a percentage of a year's salary. So it's quite reasonable within the norms in the industry.
Sort of like if you're recruiting, it might be is it like it, and because for us, again, as I said, there isn't any budget for it. And so we are always quite cost conscious, and we kind of, hopefully we get referrals through friends or, friends of friends and family and stuff like that. But obviously this would be great. And as we're building our budgets for the next year and trying to fill out, is it in this 5% range or 10% range or 20% range?
It's in the 10% range, 10 to 12.
Okay. And then one other thing that we've been challenged with in particular is that some of these communities that these seniors live in, who have sort of that pile of retirement money, where the houses they live in are filled with them, and then there's no houses left for anybody else because they don't like to rent out their basement suites, or what is left is expensive because those folks that are retiring have the ability to pay reasonably high rents. Is there do you see a housing component? I'm speaking from experience both in Sydney and in Qualicum Beach, both, very, number 1 and 3 seniors communities in Canada, very expensive places to live. Does TalentBox have a housing solution, or how do you see that? And I'm sure it's the same in a number of other communities.
Yeah, and this is a question when I was ADM, I got all the time. So the tech sector. So, and, we heard it continually, which is great, so there was a disparity in wages between, I think it was somewhere around 30% in the tech sector between Silicon Valley and Vancouver. And yet that same disparity in housing costs was almost exactly the same. So it wasn't just 30% less money paid here, you're 30% more cost on housing. We can't pretend to be all things to all people. We will certainly work to be and get creative on housing. And, going back to Al's question on rural, the opportunity for housing in rural places like Seychelles and Campbell River, et cetera, is much better from a cost standpoint than it is in the lower mainland, where it's just completely out of control. So,
but it's an availability issue though that we're faced with, and I think it's another lobbying thing for BC Housing or somebody to say we need to build places for these people to land so that they can, at least for 3 or 6 months, get settled.
I do note that both the provincial government, but in particular the Metro Vancouver and Vancouver in particular, are doing new zoning and building housing for first responders, fire workers, police, nurses, et cetera. So that's certainly a lobbying effort that needs to be made, and we'd certainly be prepared to be part of that. So, but as I say, we don't have a back pocket solution to it, because if we did, I'd be premier for life. So. Any other questions?
It's a serious consideration and serious issue that you're raising, Gavin, unquestionably. And I think that from an advocacy perspective, I did 8 years of consulting with Vancouver Economic Commission, and was on a couple of different housing advisory things. And I think that continuing to do the advocacy work through the economic and cities is really important, while simultaneously getting through the provincial and federal channels. But I think that there are unique solutions that I've seen be possible from an employer perspective, in terms of shared housing accommodations or things like that in the short term to help settle individuals. And certainly through Patrick's network as well, through settlement services, the hope and the opportunity there through settlement is that we can tap into some of the available resources potentially that are funded through the provincial government, identifying where those opportunities or those pieces might lie.
Thank you. So Laura, I note that there's 3.5 minutes left. So why don't I wrap up? Laura, are we able to send, should I give an email address here or can we send it to the participants?
I think what we'll end up doing, Rob, is we can send everything to the participants, including your contact information and the slide deck, if you're comfortable with that.
Yeah, we are.
Okay, that's fantastic. So we're ending a few minutes early, but there don't seem to be any more questions. So we'll give folks a couple of minutes back in their day. So I just wanted to thank everyone for attending this informative session, and of course to thank our wonderful panelists. Like I said, we will send out the contact information. So if you have questions, please do feel free to get in contact with Rob and Laleh and the rest of the team there directly. So thanks very much, everyone, and have a nice rest of your afternoon.
Can I just make a quick comment?
Yes.
Again, thanks everybody very much. Very glad to be a part of this. And as I didn't sort of do the preamble, but I have a lot of experience sort of, there's probably lots of other questions. And if anyone else had any questions they want to shoot to me directly, they're more than welcome. But we've had just working with, whether it's an immigration consultant or a recruiting company, we've had massive success, extremely loyal team members that have joined and highly valued for the long term through the process. So I'm definitely a major advocate for us. It's been the LMIA primarily, but it's just been critical to our business, and I hope that other people are able to, you know, after this, have a better sense of maybe the process and able to take advantage of it, because it seems like just a large part of the solution for us right now.
Thanks, Gavin.
Thank you so much, Gavin, for that generous offer. Always fantastic to learn from your peers. Okay, well, with that, we'll let everyone go and have a great rest of your afternoon.
Take care.
Yeah.
Thank you so much.
Thanks.
Thanks.